Well, thanks for taking a look at this video. Today we're joined by Marcia Spoto, who is the chair of the subcommittee on value-based care for the practice committee for APTA Orthopedics. And the topic today is really on something that I think a lot of folks have misconceptions about or are baffled by, and that's value-based care. And Marcia is really our expert on this. So let's just go ahead and dive on in about what value-based care is and see why it matters to you. So let's start, Marcia. What is what is value-based care? Let's start there.
Well, the simple definition is healthcare that produces the best outcomes at the lowest cost. In a healthcare system that was designed to pay providers based upon the type and number of services rendered, this model shifts toward rewarding providers for health outcomes. So health metrics take on a stronger role. And I would say for physical therapists, that means really focusing on functional improvements and patient satisfaction.
Okay. So who decides the value of that?
Well, that's a great question because value is in the eye of the beholder. We've had a lot of discussions about this. Certainly through the physical therapist lens, our focus is on restoring function as quickly as possible for our patients. And I think our patients are interested in that as well. But for the most part, we're interfacing with both patients and payers. So in our world, insurance companies will set the benchmarks, but patient-reported progress and experience carry a lot of weight too. So in short, both the numbers and the patient story matter.
Okay. Well, another foundational question, why should PTs care about this?
Well, although it's been a very slow-moving train for our profession and value-based payment models are still in development, physical therapists that really understand the foundational principles can create opportunities within their workplace. It also positions the physical therapist as a problem solver in the larger healthcare system, helping to reduce downstream medical costs. So if you're engaging in the process and hitting your targets, you're not doing good, you should be doing well. So it really translates into your success right now as a practitioner.
Got it. So is it the same then as fee-for-service?
Oh, no, not at all. Fee-for-service rewards volume. Value-based rewards results. So under fee-for-service, more visits means more payment. Value-based flips the model by tying reimbursement to actual patient progress and efficiency. That looks very different depending on the payment model, but that's the essence of it.
Okay. And so does it lower patient costs?
In many cases, yes. So when patients achieve the earliest access to physical therapy services, patients need fewer visits overall because rehab just is more effective. Plus, preventing surgeries and unnecessary ER visits or avoiding chronic medication use can result in significant cost savings for both the systems and the patient. Yes.
Okay. Okay. Well, so in setting this up, what metrics matter?
Well, that's a really good question because the search for the right metrics is really key. Insurance companies, they still focus on cost and utilization, but they really look also at patient satisfaction. And they're really starting now to integrate functional outcome scores into their decision-making. And in fact, I would say the most successful value-based payment models in physical medicine incorporate functional outcomes. What payers really need to do more effectively, in my view, is to understand the impact of physical therapy intervention and timing on overall musculoskeletal costs, both upstream and downstream. So downstream costs, for example, associated with specialist referrals and surgical interventions. But I think they really need to adopt more of a total cost viewpoint.
Okay. Well, so is patient satisfaction really measured?
Oh, yes. And it matters a lot. Payers and networks often use post-treatment surveys to gauge a patient's overall experience. So even if your outcomes are strong, low satisfaction scores can, hurt your value ranking.
Okay. So let's say you're a PT, in practice and focusing on orthopedics, and trying to make this happen. How does documentation change?
I'd say the main impact on documentation is collecting more detailed data on patient progress toward established goals. So you have to be obviously always thoughtful about establishing those goals, but how you're going to measure them. So there's more emphasis on measurable progress. That means being a bit more strategic in the selection of baseline measures, and then being systematic, very importantly, being systematic and following up. Really the story your documentation tells is just as important as the treatments you bill.
Okay. So is this just for big hospital systems?
Oh, not at all. But I would say the role of the physical therapist will differ between those that practice in a hospital system or institutional setting and private practice. In the latter, the physical therapist has more control over the metrics. And in fact, small clinics can sometimes adapt faster because they don't have as much red tape. The key is really having reliable outcome tracking and a willingness to change your processes.
Okay. Another sort of businessy question: can value-based care boost referrals?
Definitely. When physicians see your patients recover faster and with fewer visits, they're more likely to send people your way. So strong word of mouth from happy patients never hurts.
Yeah. Okay. Well, so how does a PT then have to treat fewer patients?
No, it's really more about treating each patient smarter. So by focusing on efficient care plans and home programs, you can maintain or even increase your caseload while still delivering great results. But the importance is being patient-centric.
Okay. So then what about chronic pain patients?
Yeah, the model can adapt to chronic pain patients as well. The focus certainly on long-term functional gains over short-term relief aligns perfectly with chronic pain rehabilitation. The key is tracking gradual improvements and setting realistic goals. You may
Okay.
have to measure, again, more consistently.
Okay. So then is tech involved?
It certainly can be and often is, increasingly so. Many clinics use EMR dashboards, outcome measurement tools, and even patient engagement apps to collect and track data. So technology can actually make it easier to prove your value through data, and I think we're going to see a lot more of that in the future.
Okay. Well, then does it mean more reporting work?
Initially, yes, because you'll really need to build systems for collecting and sharing outcomes data. But once it's set up, the process often becomes easier. The payoff is that the data can be used to market your clinic's success as well.
Okay. So it can increase revenue. Can it increase revenue?
Oh, absolutely. If you
Mhm.
hit performance benchmarks, many value-based programs offer bonuses or higher reimbursement rates to high performers. So that is a performance-based, value-based care model, for example. So over time, delivering better results can be more profitable than traditional billing. Yes.
Okay, got it. I've had a lot of members contact me about the frustrations with MIPS. And so they're hoping that this might be a passing trend. Is it, you think?
No. I think it's value-based care is here to stay. Again, physical therapists have been brought in a little bit later in the game. So again, I think there is this sense that maybe we can avoid it, but no, costs are continuing to rise, and payers are under pressure to get better results at lower costs. That makes outcome-driven care models very attractive to them.
Got it. And so will payers pay faster under a value-based system?
Actually, in some cases, yes, because if you meet your performance targets, you can be placed in a preferred provider network, I should say, which sometimes means faster payments. It also reduces disputes over billing because the value is proven really upfront. So it can really actually make the payment piece a little bit easier.
Got it. And we also have members who contact us in small clinics who feel like they don't have much negotiating power. Can they, negotiate value contracts?
Absolutely. That's tied to that data collection. That's why it's so important to systematically collect data. And we really encourage that. We encourage providers to negotiate contracts and to view their contracts. So if you have strong outcomes data to show payers, you're in an advantaged position. The more you can prove your patients improve quickly and cost effectively, the more leverage you have. So even small clinics can win these contracts if they track results well.
Got it. So bottom line, what's the biggest PT advantage?
Well, we're low-cost providers. We help people recover without expensive surgeries or lifelong meds. That makes us a cost saver in the system, desperate really to cut waste. And there is a lot of waste. But if we can show that impact with data, we become indispensable.
Okay, and just to start up, what's one tip for folks who might be interested in starting a value-based model?
I would say just become very strategic in your selection of metrics. And I'm backing up. The very first thing and most important thing is to really understand the cost of providing your services. So you really have to understand your costs as a first step. But then you want to become strategic in your selection of metrics and in your data collection. And again, setting up these processes so they're automated. So work on your system and build that habit now. And then you'll be ready when value-based opportunities come your way.
Perfect. Okay. Well, thanks so much, Marcia. It's very illuminating and helpful. I hope folks get involved in this. And yeah, like you said, it's not going away. So time to dive in. Thanks again.
My pleasure. Thank you.